Hi, my name is Kirsten Eagles. My student number is T00698082. And in this video, I'll be doing a full anesthetic protocol on a feline patient. So we're going to be doing a dental procedure on Noodle today. So Noodle is an 11-year-old cat, so she is a little bit older. So we want to choose a pre-anesthetic agent, an induction agent that's not going to cause too many changes in like heart rate, respiratory rate, that sort of thing, as well as we want to protect her kidneys and liver a little bit. So for our pre-anesthetic agent, we're going to do Valium and Torbugiesic, just because there's not going to be as much effect on the heart rate, respiratory rate, and cardiac output. As well, it's going to help protect her liver and kidneys, and it's not going to hit her too hard and too fast. And then with that, we're going to follow up with propofol. So with propofol, we do just want to make sure that there's no apnea happening, so we're going to give it fairly slow. We'll titrate the dose as we induce her. And then we're going to continuously monitor her just to make sure everything is all good. Okay, so we're going to be getting Noodle ready for her dental. So she's already been checked out. She's all good to go. We're going to start with placing our IV. Off her hair. Yeah, it's blowing. I'm going to take that out. Okay, so we're going to attempt again. Just going to redo our scrub here. Okay, so Noodle has her IV in, so we're just going to take a listen to her before we give our the anesthetic drugs. Alright, so we're going to start with our Valtor.
I told them that I thought probably detected influence, so I think they just wanted to make sure you're finding if you wanted to follow up. So I think probably. Okay.
What did Barrett say?
Buzz is doing much better.
Okay, good. So he's not going to come back in for the repeat blood?
I didn't ask that.
We're just going to flush with some saline. She's going to start getting sleepy there. And when she's a little bit sedated, then we're going to go ahead and give her propofol. All right, so we know that it's taken effect here now. She's relaxed. Her third eyelids are starting to rise a little bit, which is common with Valtor. So now we're ready to give our propofol. So we're going to start with giving just a quarter of our dose. So her dose was 1.9. So we're going to give about 0.47 or so, 0.45. We'll round up to 0.5. And we're going to flush with saline. Turn the fluids on. She's getting sleepy there. So she no longer has a blink reflex. Ears aren't twitching. Well, a little bit. Alright, we'll check jaw tone as well, just to see if she's ready to be intubated. Good there, she's not fighting it. Okay, so we're ready to start intubating. So I have 3 tubes, so I have a size 4, a size 5, and a size 6. I was thinking she's going to be about a size 5. So first what we're going to do is we're going to numb the larynx a little bit, just with some xylocaine spray, just to help with any laryngospasm. Right. Let that take effect for a little bit. We'll get our tube ready. Have our stylet. Right. We just want to make sure our cuff's deflated and everything. Good. All right. So Kim's gonna hold the tongue for me while I intubate. Check here. Alright, so we're likely in the esophagus, so I'm just going to take that out and we're going to retry. Went down a little bit too easy.
Yeah, and then
Okay, so she was too small for the 4 size tube as well, so we're going down to a 3.
It's like the perfect level.
Alright, so she's coughing, and we can check with hair as well. You can see the movement there, and you feel expired air. So, we're ready to tie that into place. Okay, I'll go ahead here.
We're just taking blood from the kidney.
We're gonna hook her up to the anesthetic machine. And put her up to about 1 liter per minute.
Thanks. Look at all that.
And we'll set her to about 1.5 for ISO.
Beautiful.
Okay, so I'm going to listen for a leak. So I'm just going to hold the pop-off valve and just squeeze the bag. So we've actually got a really good seal, so we won't need to put any air into the tube. So now we're going to get her hooked up to the monitoring equipment. So Kim's just going to hand that stuff over for me. Alright, so we don't have a Doppler or an esophageal stethoscope. So for the Doppler, where you would put it, so you would put a cuff up here, and then the Doppler would be going on a shave spot, just kind of just proximal to the metacarpal pad. You would attach the probe or the sensor there with the electrogel and listen to the noises that the artery is making. Then for the esophageal stethoscope, you would measure to about the 5th rib for the probe, and you would enter through the esophagus, and then that's going to listen to the heart through the esophagus. But for now, we're just going to hook her up to blood pressure, ECG, and SpO2. So where we're working in the mouth, we're going to put the SpO2 probe onto the ear pinna.
And she's doing good. She's not having
ECG leads white, black, red, alcohol on those. And then for temperature, we're going to monitor just with a thermometer. So we are all good there. So now we're going to watch our vitals. We're going to take a listen to the heart rate as well. So not many changes in heart rate. So we know that she's in stage 3.2 because we no longer have any reflexes. So no blink reflex, no jaw tone, no swallow reflex. As well, there's minimal changes in heart rate and in respiratory rate. The eyes as well have gone kind of intermediately, so we're looking to the middle. So we would know if she's changing out of that plane, if the eyes were to come up, if she would start to get some reflexes back. Okay, so the dental procedure is all done. So we're ready to turn her off of ISO. So turn that off. And I'm going to leave her on oxygen for about 5 minutes. I'm going to continue to monitor her while we're doing that. She was a little bit cold during the procedure, so we have lots of warmies on her to keep her warm. And then once we turn off the oxygen, we'll move her to recovery. All right, so we're all disconnected, so we're ready to take her back to her kennel. wrap her up. Disconnected her fluids and everything as well. Okay. There we go. So, while we're recovering her, we just want to make sure that we start getting those reflexes back, so that once our blink starts to come back, and then our swallow reflex, so everything's going to come back in reverse order that it went away in. We want to make sure that our cup is deflated. We didn't put any air in this cup, so we don't have to worry about that, but we want to make sure it's deflated so that it's ready to be taken out. We can have our tube untied as well. And we're going to continuously monitor for this next little while, just to make sure that she recovers properly. So taking temperature, monitoring heart rate, respiratory rate, just to make sure that everything is okay. And then we'll monitor as well just for any vomiting, and especially with dentals, there is the possibility of aspiration. So we just want to keep an eye on that as well. We're waking up well now. What we're going to be doing as well is we're going to be giving some analgesia. So the doctor ordered some long-acting buprenorphine to be given, so we're going to give that once we're a little bit more calmed down, just because we don't want to flail around too much. So once that's done, we'll have the buprenorphine that we'll give.